Good day, I'm back again, your host with the most information about nurses. It is yet again your program, Nurses Forum with Lovers. Today, we'll be tackling another program, another topic, focusing on interviews. So today, we're looking into some interview tips. What is it that you need to consider before undertaking an interview? So this is, of course, for nurses primarily, but it can also benefit if you're non-medical or if you're in any other medical field, be it a doctor, a pharmacist, a radio therapist, or any profession. You can still get some of these tips. So you can benefit in some of these interview tips today. So without wasting much of your time, we need to look into what is it that is expected of you in an interview, typical interview. First of all, you need to have your CV, your curriculum vitae has to be on point. I'm not going to dwell on the contents of the CV today, but you just need to have a relevant CV to the job you're applying for. So whenever you're making an application, make sure that your CV is relevant and it is in the order. Don't clutter your CV. Just be specific to the information that is required or that is in accordance with the job that you're applying for. Don't put irrelevant information. All right, and your CV should be at least a maximum of 3 pages, not more than 3 pages, 2 to 3 pages, right? If it can be 2 pages, the better. Don't put a lot of information because they will definitely go through your CV, okay? So make sure that your CV is ready, and one of the things that you also need to do is to prepare the environment for your interview, okay? So make sure that you have strong connectivity in terms of internet, right? So that there is no buffering and there is no, I understand that there could be different challenges, electric challenges in some places, in some areas, internet challenges, but you need to thrive for strong connectivity because this is important for you. So again, I need to advise you not to use a phone for your interview because the phone can be really an inconvenience during your interview because you cannot turn off data because that's what you're using for. And yet again, calls and messages can come through your phone and that can interrupt the conversation or the interview that you are having. So I rather encourage you to use a gadget that cannot be disturbed, most probably a phone, a laptop or a desktop. I'm not so sure of some pads. Yeah, you can use some gadgets that will make sure that there's no disturbance or calls or messages coming through you, and then that can be a cause for concern and that can interrupt the conversation in interview. Interviews usually they take about 30 minutes, so you need to maximize your time on the interview. Others, you will be interviewed across the globe. It's not only you. It's not only an interview happening in your country, but they're interviewing quite a lot of people, and what they need to choose is the best candidate for the job. So you need to sell yourself better. You need to sell yourself well. That means you need to be confident in your approach, all right? You need to show a lot of confidence. So, and be fluent and be heard, okay? Be clear when you're speaking. Don't have your voice low. Don't look down when you're being spoken to. You need to face, the adjudicators. You need to face the interviewers. You need to look them in the face. You need to have your hands where they can see them. no paper, nothing. Don't write anything. When you're being asked, yes, probably you can write something like a question if you wish to, but don't do a lot of movement, body movement. You need to be focused on what is happening. And then the other thing we need to talk about is the dressing. So make sure that you're dressing formally. Do not overdo it. As well as the makeup for ladies, keep it minimal. Keep it minimal. Don't overdo your makeup, all right? And because this professionalism rather, so you need to keep it professional. And the other thing also is to remove clutter from the background. Make sure that your background is free from clutter. By clutter, I'm referring to, things that are not necessary, equipment. It has to be a background that cannot disturb the concentration. The interviewer should not concentrate on your background instead of concentrating on you, the interviewee. So you need to make sure that there's no clutter on the background, and you need to be visible. Like I said, be visible. So you need to have light in the room enough for you to be visible, because the interviewers wants to see you, the candidate, and also be able to observe your confidence and your ability to communicate, because interview is about assessing you. You can tell about somebody by merely by merely hearing what they're saying. So this is how important the interview is. The way you speak is the way that you're representing yourself. So you need to be very, very careful. And one of the things you need to do is be on time. Okay, don't delay to be on the interview. So you need to be there at the venue of your interview at least 15 to 20 to 30 minutes before the interview time, because your agent might want to test the connectivity and make sure that you're ready for the interview. Of course, your agent can actually hold a mock interview prior to the actual final interview with you, so as to check the connectivity and the gadget that you're using, if it is proper, and also your ability to connect to the platform that will be used online. It could be a Zoom meeting or a Skype. So you need to have a Skype ID. You need to know how a Zoom meeting works. So you need to try some of these platforms with your friends, so that you are acquainted with everything that goes on in an interview. So I know and understand that sometimes network can be very bad in some parts of the world. But my advice to you is still you need to do the interview. If you cannot have enough data in the phone, if you do not have internet where you are, you need to find a place where you can access the internet, like a hotel. It could be some offices. You can ask some friends. You can go to the hotel and explain your situation. Don't be afraid to approach certain individuals or organizations to help you with a place for interview. You can pay in some instances. Doesn't matter. What is important is for you to have an interview that is uninterrupted. I discourage going for an interview at an internet cafe. That's a public place. The one thing that you need to avoid is to go to a public place for an interview. Your interview won't go well, because there'll be a lot of interruptions there. There'll be a lot of activities up and down, people coming in and out of the internet cafe. Unless it is a solo place, it is quiet and it's not busy, yes, you can. So you need to find a place that is so private, okay? And so yeah, that's just about it. Then, after having said that, that was just the background of how you can prepare your interview, right? So, we want to go into some typical interview questions, a few interview questions. But then, one aspect of importance is for you to understand about the hospital that you're going to, have a brief understanding, knowledge, or history about the hospital, the bed capacity, the catchment area about that place. You need to show some interest of the place you're being interviewed for, or the place you shall spend much of your time at. So you need to understand. Also understand the place, do a research, ask some colleagues about the rental issues before even considering the interview. How you can then settle in with your family, the schools availability, accommodation issues, how expensive, do you want a busy place or a less busier place, environment. Those are some of the backgrounds that you need to know and understand, and also get to understand about the hospital that you're going into from some friends and colleagues that are already engaged in such a place. It is for your advantage and beneficial. Right, so let's quickly look in some of the typical interview questions. One of the common interview questions that you can be asked probably is the first question that can be probed up on you is tell us about yourself. Tell us about yourself. What this question or this question aspect, what this question is about is not, it's not about your personal life, okay? It's not about your personal life. They're not trying to find out whether you're married, how many children you have, and where do you stay, do you stay in a full house, are you renting, who do you have parents, are your parents alive, where did you grow up, is your grandfather still alive? No, it's not about all that. What they're simply trying to extract from you is who are you in relation to the job, in relation to the profession. So you need to tell them about a profession. For example, I'll give you just a snippet example. My name is Lovers. I'm a nurse by profession. I have 13 years of experience in the nursing profession. Currently, I'm working in a medical ward where we nurse about 40 patients. It's a 40-bedded hospital, ward, and we nurse 40 patients in a day, almost in a day. And our daily routine there is basically receiving a handover in the morning and being able to interact with the patients on the handover or soon after the handover to prop them up and prepare them for their breakfast, and also to assist those who need feeds, also looking into their medication to be able to give their medication. Soon after the medication, we'll commence the baths or the washes to make sure that their daily activities of daily living are attended to, especially hygiene aspect. And we also do some vet observations on the patients to ascertain that there are no abnormalities in as far as their conditions are concerned. And we'll also be doing some drug rounds with the patient. Sorry, not drug rounds, but doctor's round, doctor's round. And okay, I'll stop. Basically, you've given a routine that you do in the morning. You can go on in the afternoon what you do some writings on the patients, you follow the doctor's orders, and make a follow-up on the multidisciplinary team that you will be actually working with as a professional. So basically, that's an example of what they'll be asking you. Tell us about yourself. You can tell us also in that same vein of a question, your passion, enthusiasm, or your strength rather. What are your strengths? What are your strengths as a nurse? Are you compassionate? Are you are you uh, are you an educator? Are you a team player? Are you committed? Are you punctual? Give us your strength. We don't want to hear about your weaknesses. At times you can be asked that question, what are your weaknesses? What are your strengths and what are your weaknesses? Your strength, of course, will be obvious. But when you're asked this question, what are your weaknesses? You don't need to dwell on the actual weakness per se, but you can look into an aspect that you do not have control over, but it is to the benefit of the patient. We don't want to hear a weakness that is detrimental to the health of the patient. So you can't tell us that you're forgetful about about a sick patient, or give us an example of whereby you were so forgetful or negligent, or you gave a patient the wrong medication and as a weakness, and you always do that from time to time. Of course that can happen, but you'll be giving us as a weakness that it is something that you do day in and day out. There's no employer who can take you after having said that. So I'll give you an example of a weakness. An example that I can give you is that I'm an workaholic. I'm a workaholic. I am a workaholic. That's supposed to mean that I work too much. I don't really give myself time to rest. I'm always on the plow. I'm always working. I'm always doing one or two things. I don't have time for myself. That can be a strength, but a weakness in a way, because what you need also to do as a person, as a nurse, working with other people, you cannot be doing everything all the time by yourself. You need to learn to delegate some tasks, be able to delegate some of the responsibilities, because you cannot do everything by yourself. There's no time here. I can see time is moving very fast. So what type of medical surgical conditions you're treating at the moment? That can be a question that can you be asked. Okay, so you need to ensure that you list conditions that you are attending to. It's easy to use your body to not forget certain conditions. You can look into this part of the body, the head, what happens there, neurological conditions. You can talk of neurological conditions. You can talk of the respiratory conditions. Look at the nose, of course. Neurological is in the brain here, there. You can talk of respiratory conditions from the nose, of course, the lungs also involved there. But just looking at your body as a chronological order of addressing some conditions. You can look at the heart, the conditions that affects the heart. You can look at even the lungs as well, like COPD conditions, respiratory conditions, pneumonia, and all those kind of things. You can go down the abdomen there. What are conditions that you can find in the abdomen? You can have gastritis. You can have ulcers. You can have, some surgical interventions there. And you go down to the urinary system or the reproductive system, the different conditions that happens there. So you can mention in that order. And other question that can be asked, what does COPD mean? And this question you need to ensure that you are able to speak about this condition in detail. What is COPD? That is chronic obstructive pulmonary disease. Tell us how it starts, okay? What it is it in full? Define COPD, all right? What are the precipitations? What precipitate or what triggers COPD? Is it genetic? Is it environmental factors? So is it just due to smoking? So tell us what it is, okay, and how it presents itself, the signs and symptoms of COPD, and how will you be able to alleviate the signs and symptoms? That is to say, the treatment regime. Are you giving the patient some antibiotics? Are you giving the patient some corticosteroids? Are you giving the patient some painkillers? Are you giving the patient some nebulizations? So those are the things that you need to look into, and also consider health education to the patient. Does the patient need to stop smoking? Are there other alternative ways of smoking? You can talk of the nicotine patches and stuff like that. Also look into the complications of COPD, right? And the oxygen levels also of COPD. What is it? What is the range? Is it 88 to 90 to 92, the range of COPD in terms of saturation levels? So you need to understand all that, okay? And that can help you in a long way. Right. Another question that can be asked, what is angina and what are the types of angina? So you need to understand what angina is and different types of angina. We have stable angina, we have unstable angina. You need to differentiate what stable angina and what is unstable angina. You do a research on that, because I do not have time. I don't want to spend much of the time looking into this, because the longer it gets, people don't want to be associated with long videos and conversations. But I'll make it short and then I'll continue some other time. Don't worry. Okay, just keep watching and turn on the notification button so that you receive more of these videos that I'm making daily or on other days. Okay, so on angina, also look into the OPQRAST. Okay, OPQRAST, what it is, what it can really help you to analyze whether this is COPD. That's the onset there on O. P, that's the provocation, what provokes the pain. Q, quality of pain. Is it dull? Is it sharp? OPQ, R, is it radiating? So radiation, is it radiating? Excuse me. Is it radiating to other parts of the body? And then as for severity, out of 10, 1 being 0 being no pain, 5 being moderate pain, 10 being severe pain, on a scale, how severe is the pain? And then T is the time frame and also the time to act. How long is it taking? Is it taking beyond 5 minutes? Because stable angina do not go beyond 5 minutes. Okay, unstable angina goes beyond 5 minutes. And unstable angina is a medical emergency. So you need to know and understand. And of course, the patient needs to be propped up and to be given oxygen. And the treatment for angina basically is GTN. And what you need to understand about GTN is that GTN has a tendency of lowering the blood pressure. So you need to check your blood pressure or vital observations of the patient prior to giving GTN. And that you can give at least 3 doses of GTN in a space of 5 minutes, after every 5 minutes, if there are no changes. But each time before you give GTN, do your vital observations to make sure that the blood pressure is not lowering down. And the patient who is receiving GTN should not sit up immediately, because it causes postural hypotension. The patient can fall down, causes dizziness as well. And the patient who is having GTN should avoid taking fluids, water, because it has to be a slow release going into the system. So if you give the person water whilst taking GTN, you're actually defeating the purpose of the slow release, because it will be swallowed down. So basically, in a nutshell, that's about angina. And then how will you treat a patient with heart failure? Look into the conditions that affects the heart, and there are different conditions. And let's look into this one. Wound infection, how will you treat? Okay. So on this one, you need to understand your IPC, infection prevention control measures. So look into IPC protocol, your hand hygiene, your PPE, your aseptic technique, and your 5 moments also. You need to understand them. Your 5 moments of hand hygiene. You need to know where to do a hand hygiene, where to do actually a hand wash and a hand rub, hand wash. And these are all in the spectrum of hand hygiene. Right, and then signs and treatment of sepsis. So you need to understand what sepsis is, right? And the signs and symptoms. You can use the pneumonic sepsis, look it up, you can find it. The pneumonic sepsis itself, you can use sepsis as a mnemonic to determine the signs and symptoms that comes with sepsis. And, the sepsis form also, you need to be aware of it. You need to know what goes on sepsis, the stages of sepsis, and the I-news also, that will guide you to say this patient is developing sepsis. And also you need to understand what 6 bundle is, where you take 3 and give 3. What is that about? And how much time is spent on sepsis 6 bundle. And what is sepsis 6 bundle? It's basically when you suspect that the patient has sepsis and you begin the management of the patient immediately, and that's what is called time 0. So from that time 0 to 60 minutes, you should have managed the patient, given the 3. That's, you give oxygen, fluids, and microbials according to the local guidelines. And also you look into the text. You take bloods for culture and other bloods, and also you take FBC, you take bloods for FBC, U&Es for lactate and all that, and you do your urine output check or measurement, intake and output, to ascertain that the patient levels are within the normal ranges and expected ranges. You need to understand also the amount of urine expected per patient in an hour or in 24 hours. And also you need to understand the lactate levels, that they should always be less than 2. So those, because when the patient is lactate, when the lactate is high, well, you understand that there are oxygen issues there involved. There's depletion, there's no oxygen in the tissues, and the patient would really need the oxygen, and that's a sign of sepsis when the lactate levels are high. And when there is no change also of this vital of blood pressure, no change in lactate after having given the 6 or after having giving the fluids the patient required, or at least then you have to worry about sepsis. And that's when you say the patient has sepsis. So I've gone a little bit deep in sepsis in a nutshell, but those are the information that you need to understand and know. And you can get this information from the website, RCSI website, that will guide you. So these are the tips of interview for people basically coming to Ireland. And sorry, I forgot to mention that, because the RCSI, you might wonder where the RCSI is or what is it about. So it's basically for nurses coming to Ireland. As I get to understand other people, how it goes in different parts of the world, I'll be willing and happy to have you on board on this program so that we discuss what is expected in that part of the world. Please contact me on lpamire@gmail.com. That's my email address. And then we also look into MRSA patient positive. When a patient has MRSA, these are superbugs. So MRSA, that's methicillin-resistant Staphylococcus aureus. So if a patient has this condition or infection, because it is infectious, so precautions have to be taken. Patient obviously is isolated, and anyone going into nursing this patient should put on full PPE, okay? Full PPE to avoid droplet, to avoid contact infection, okay? So there's VRE, there's extended Staphylococcus beta-lactamase, ESBL, there's also C. diff, okay? Some are droplets, some are contacts. So you get infected when there are drops going on to you, or inhale these drops, or you get infected when your body is in contact with the patient infected, especially with these conditions like MRSA. So you need to take precautions. The IPC also, you need to take it into consideration, or to put it into consideration. And also, it's the same, the way you treat a COVID patient is the same you can treat this patient with these superbugs, okay? It's the same approach. So for now, I'll stop here. I don't want to have these videos long. We'll continue and to see where we can go and cover more ground on these typical interview questions. Thank you. Remember, subscribe, all right, and turn on the notification button for more information, and like. Let's have some likes. Give me some questions, okay? Anything you want to share with me in the comment section box. Thanks. Bye bye for now.